Good afternoon, and welcome to today's webinar, Talkspace Mental Health Therapy for Justice-Impacted Youth, an overview and demonstration. Before we get started, here are a few reminders about the webinar technology. Please make sure you're using a computer or smartphone connected to the internet, and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman-Bridges and Mary Beth Brown. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions, an overview of the Talkspace partnership, and a demonstration of the platform. There will also be time for questions after the presentation. At this time, I would like to turn it over to Kelly Shusko, Family Services Team Lead for the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, everyone, for joining us today. We are very excited to share with you all about our new partnership here in North Carolina with Talkspace. I'm Kelly Shusko. I am our Family Services Lead here at North Carolina's Division of Mental Health, Developmental Disabilities, and Substance Use Services. Our team has a really unique objective to serve youth across the system, addressing mental health needs, needs associated with their involvement with the juvenile justice system, substance use services, and as they transition into adult services. Our team, three of our areas of focus include mental health services for justice-involved youth and their families, which is one of the reasons we're talking about Talkspace today, mental health residential treatment for children and youth, as well as advancing first episode psychosis coordinated specialty care programs. I'm pleased to be joined today by three colleagues from Talkspace, which include Gabriella Steich, Lyra Jackson, and Erin Mack. While we're together today, we have a number of objectives for this webinar. First, together, we will understand how Talkspace supports the division's strategic plan as well as the pilot goals. We'll identify the pilot's targeted youth population and how to connect with them through Talkspace. We will learn about the three core components of North Carolina's Talkspace partnership, and we'll review the Talkspace program features as well as the platform's privacy, security, and clinical safeguards for youth safety. In 2024, North Carolina's Division of Mental Health, Developmental Disabilities, and Substance Use Services developed a 5-year strategic plan. Talkspace very uniquely helps us to advance two of the key priorities in this plan. The first is at the top of this slide, which is increasing access to care. As a division, our goal here is to ensure that children, adolescents, adults, and their families can access timely, evidence-based mental health services and that they can remain in care for the recommended duration. Through Talkspace, we will now be able to proactively reach youth who are not yet connected to mental health services, but who could benefit from early intervention and additional support. Because of the platform, Talkspace very uniquely helps us to address some common obstacles or barriers to care, such as stigma around seeking mental health support for young people, limited availability of services in certain areas of our state, as well as financial barriers that families often encounter or insurance limitations that prevent them from accessing the care that they need. The second priority that Talkspace helps us to advance is to expand services for our justice-involved youth. As a division, our commitment is to increase the use of evidence-based programs and practices to support youth involved in or at risk of entering the justice system. In so doing, we've also adopted a focus on prevention. We really want to leverage tools like Talkspace to provide accessible, preventative mental health support and reduce the likelihood of justice system involvement. So let's talk a little bit about North Carolina's partnership with Talkspace. We are so excited because this truly is a first of its kind initiative. This is in North Carolina, this is the first program that's been designed specifically for a targeted population of justice impacted youth. Um, it leverages innovative, accessible mental health tools that meet youth not only where they are, but in a way that they feel most comfortable to engage. As we know, our youth are very adept at engaging digitally and virtually. We have structured this partnership as a 2-year pilot through which North Carolina will offer Talkspace as a free resource. We have the ability to do so through North Carolina's historic investment in mental health system transformation. This pilot program has been designed to support 20,000 youth who are impacted by the justice system through a focus on early intervention, prevention, and sustained mental health support. It's important to note that this is a pilot, and so our 2 years are supported by one-time limited funding. Therefore, over the next 2 years, as a division, we are committed to first evaluating the program outcomes, identifying opportunities for long-term sustainability, and building a case for continued investment in accessible mental health services for our vulnerable youth. I mentioned that this is a one-of-a-kind program due to its targeted population. So let's pause a moment and talk about who we are trying to reach with Talkspace. Our primary population of focus are youth who are at risk of or who are currently involved in the juvenile justice system. As we know, these youth often face barriers to mental health care, such as stigma, service availability, and as I've mentioned earlier, cost of service. As we began planning this opportunity, we decided to expand the targeted population to also include youth who have parents or caregivers who are either incarcerated or otherwise detained, youth who have been victims of crime themselves, because we know that both of these experiences can be considered adverse and may lead to emotional and behavioral health challenges that increase their risk of future involvement with the justice system. So combined, these two populations represent youth who right now are often underserved, may often also be overlooked in our traditional mental health systems. So by focusing on this larger group, we aim to truly interrupt the cycles of trauma and justice involvement through early, easily accessible support and intervention, thanks to Talkspace. So before we get into the platform itself, we want to talk a little bit about how you all can partner with the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Use Services to help us extend the reach. How can you help us make this pilot successful? Some of those activities may include referring eligible youth to Talkspace, sharing information about this resource, about Talkspace, about the platform with youth that you serve, that you know, who you engage with their families. Share it with your staff, with organizations who serve youth in your communities. You can help us by making recommendations for how we can connect to other key partners who are serving youth and families who may be interested in learning more about Talkspace. You may incorporate Talkspace into your own organizational efforts around engagement, outreach, and education. Um, and perhaps most importantly, you all can provide us feedback about individuals' experience with the platform as a professional, your experiences with this platform, and the benefits that are encountered through Talkspace. And at this time, I'm going to pass to my colleague, Gabriella, so she can provide us with a lot more detail about Talkspace and walk us through a demo. Gabriella?
Perfect. Hello, everyone. Just making sure we see my slideshow right now. Are we good to go? Perfect. All right. Thank you for joining us all here today and for that introduction, Kelly. My name is Gabriella Steich, and I oversee the youth programs and partnerships here at Talkspace, along with my colleagues, Erin Mack and Lyra Jackson, who you will be also hearing from today. We're excited today to share how Talkspace is partnering with North Carolina DHHS to provide mental health support to youth ages 13 to 17 who have been impacted by the justice system. Our goal today is to make sure you leave this session with a clear understanding of how Talkspace works, who it's for, and how you can directly help the youth access it easily and safely. Before we get into Talkspace and how it works, it's important to ground ourselves in why this program exists. We're facing what's now being called a youth mental health crisis, as I'm sure you all are aware of. Nearly half of high school students say that they've felt persistently sad or hopeless, and 1 in 3 parents report their child's mental health has declined since the pandemic. And because 50% of all mental health conditions begin by age 14, adolescence is the most critical time to reach kids early. Specifically for justice-involved youth, the stakes, as we know, are even higher. Many of these young people have faced trauma, instability, or inconsistent access to support. The traditional mental health systems just often aren't accessible or designed specifically to help their needs. That's where Talkspace comes in. So we are bridging those gaps with care that's private, timely, and tailored to meet teens where they are. Just a little bit more level setting. One of the most powerful undercurrents we see beneath those statistics we just went over is loneliness. The US Surgeon General recently declared loneliness is a public health epidemic. Despite being the most connected generation digitally, we're seeing Gen Z is also the most disconnected emotionally. For youth who have experienced justice involvement, that isolation, as we know, is often magnified. They're separated from friends, from school, from familiar routines. And that's why one of our solutions here at Talkspace, we focus not just on providing therapy, but also on building connection. So through our TeenSpace communities, teens can safely share and support one another in a moderated, non-judgmental environment. We'll go ahead and get into that a little bit further as well in this presentation. And what is Talkspace? I'm sure a lot of you have heard of us, but we are a national leader in digital behavioral health with a footprint across all 50 states and thousands of licensed therapists and providers covering over 180 areas of expertise. We partner with over 25 leading research institutions. We hold over 3 NIH grants and have served millions of members. We combine both evidence-based clinical care with the accessibility of modern technology. So now that you kind of have a better understanding of what Talkspace is and how we are hoping to help the youth, what is the plan that is offered to North Carolina youth ages 13 and 17? So we have 3 pillars, as you see here. We'll get into each one of them deeper, but we have our main bread and butter, the Talkspace therapy. So that's unlimited messaging with their licensed provider that they get matched with when they sign up and go through their intake process and remain with throughout their course of their mental health journey. They get 1 live video session through the Talkspace therapy a month that they also can use with their therapist at any time. We have Talkspace Communities, which I mentioned is that moderated online peer support space. And then Talkspace Go, which is self-guided sessions with a 2-week mental health course designed specifically for teens. So kind of giving them, they can use all of these, one or the other. It's just making sure we're meeting them at their comfortability level. And we'll get into a little bit more of each one of these. Starting with Talkspace. So Talkspace connects individuals directly to a licensed therapist. This is through secure messaging and those live video sessions. For teens, especially those navigating justice involvement, this model provides the privacy and flexibility they often need to engage in care. They can message their therapist anytime and receive thoughtful responses throughout the week as well. They schedule the live video sessions within the portal as well when they're ready to go ahead and build off of their messaging and get a bigger rapport built with their therapist. It's also important to note that Talkspace is not to be used as a crisis service. It's designed for ongoing relationship-based support. For crisis, that is where we send to 988, or of course, as Erin, our clinical engagement manager, will go into a little bit deeper of our crisis support systems over here. And I will add who can sign up. That will be any referred North Carolina youth. So that's 13 to 17. They just need to be referred. No parental consent is required due to North Carolina state law. And we do not have insurance. We do not take insurance for the students to participate. No insurance, no credit card. If they're signing up through our main landing page, then all they have to do is sign up through that landing page and go ahead and take the intake and be matched with a licensed professional and get that unlimited messaging with the one live video session a month with their provider. So like I mentioned, in North Carolina, the age of consent for mental health treatment is 13. So meaning teens can legally access therapy without consent. That said, while parental consent is required, we do encourage open communication and family involvement whenever possible. Parents and caregivers can play an incredibly supportive role here, helping normalize therapy, encourage consistency, and reinforce progress outside of the sessions. So we want everyone to know they don't need to be completely removed from this process. In fact, when youth feel supported by the adults in their lives, they're far more likely to stay engaged in care. Then we'll go into a little bit of what TeenSpace Communities is. TeenSpace Communities complements that one-on-one therapy by giving teens a safe, moderated peer space where they can express themselves, ask questions, relate to others who share similar experiences. The anonymity here allows them to open up, while clinical moderation ensures the environment stays safe and constructive as well. It's about helping teens feel seen, feel supported, have a community, feel less alone, especially those who might not have that network in their day-to-day lives. So over on this slide, you can kind of see examples of the prompts that are given on a daily basis, and they can communicate with their peers and also share their response to their provider if they are matched with a therapist, and then go into their responses a little bit more in depth and uncover exactly how they were feeling. Then we have Talkspace Go. For youth who may not be ready to, sign up for therapy right off the bat and kind of want to ease into it, we also offer through the partnership Talkspace Go. This is a self-guided 2-week mental health course. It's designed specifically for teens. It's interactive, easy for them to follow, and it helps build that self-awareness and emotional regulation skills that we know are very important in our adult life, but then starting it at adolescence. Teens spend about 5 minutes a day on these short lessons and daily journaling prompts that they then also start with an assessment and then retake that assessment at the end of that 2-week journey to track their progress. So this is a great bridge to the therapy, like I mentioned, or they can also use it in supplement to their therapy as building healthy habits as well. All right, I'm going to play a short video so you can hear from teens themselves. We have some testimonials here to share.
When I first started therapy, I was pretty nervous about how to start.
And that's when we heard about Talkspace. And it just sounded like a really great opportunity to be able to do something from home that could fit with my schedule. I'll text my therapist and be like, hey, maybe expect me to talk to you a little bit more today because I feel a bit off. And she's like, Yeah, no worry, I got you.
My therapist is helping me by instead of me thinking about other people, I started thinking about myself more.
You don't need to know what to say to any therapist because therapists are here to help you.
Therapy has helped me focus more in school because I have ADHD and that kind of thing is really hard to grapple.
The emotional support that helped out with my therapist, since we used to do weekly sessions, it kind of gave me so much confidence. Like I can text her whenever I need her, and it really helped drive me to new opportunities.
All right, thank you for listening, everyone. I will go ahead and pass it over to my colleague Lyra Jackson, who will go on to talk about how a youth can sign up for Talkspace services.
Thank you, Gabriella. Hello. When a youth is ready to sign up for Talkspace services, they would simply go to our landing page, talkspace.com/NCYouth that you see there on the slide. We designed a welcoming page for teens to access Talkspace services easily and confidentially when they are ready to start their therapy journey. We recommend going to the page with a browser, and then once an account is created, they can then download the app and log in from there. We have a short video that demonstrates the sign up and login process for you to see. Gabriella, if you want to play that video for me.
Signing up is easy. Just make sure you start on our designated partnership page, talkspace.com/NCYouth. From there, click Get Started. You'll see a quick eligibility check to confirm the program. Enter first and last name, date of birth, to confirm your 13 to 17, the program keyword, NC Youth, your referral source, who sent you to Talkspace, and your email to begin account creation. After that, you'll go into Quick Match, a brief, about 90 seconds, set of questions to make sure you're matched with the right provider for you. You'll answer what's bringing you to therapy so we can connect you with a therapist who specializes in what you need support in. For example, stress, anxiety, family, relationship stuff, confidence, and more. From there, you'll see a quick overview of what your Talkspace journey will look like and what to expect during your first week. Then we'll move into a few short questions to personalize your match. First, you'll choose your provider gender preference so we can honor your comfort. Next, you'll be asked to rate your current sleep habits, which helps your therapist understand routines that affect mood and energy. You'll then rate your current physical health so we have a fuller picture of your well-being. On the following screen, you'll select your gender. Finally, you'll confirm North Carolina as the state where you live, which ensures we match you with a provider who's fully licensed to treat youth in North Carolina. Once that's set, we'll finish creating your account and begin the matching process. From there, the matching process starts on the back end and you'll create your account with your email and password. You'll receive your match, typically within 24 hours, and can begin therapy start messaging right away.
Thank you. You can go to the next slide. So we try to make the registration process as simple as possible, that just like you saw in the video, to eliminate any barriers or time to care. We do ask that all members verify their email address, which they will use to log in, and that way we can confirm their identity. One of the first steps to engaging with Talkspace is creating an account. We made that process really simple and seamless. Members can get started in just a few minutes by entering basic information and verifying their email. The quick verification ensures secure access to their personal portal and helps them move right into the matching and onboarding experience without any barriers. Our goal is to remove any friction so teens can start focusing on their mental health support right away. Security is at the core of everything we do at Talkspace, and to keep the teens' accounts safe, we use two-factor authentication, an added layer of protection beyond just a password. When logging in, members receive a unique verification code to confirm their identity, ensuring that their personal information and therapy conversations remain private and secure. This extra step helps build trust and gives teens peace of mind that their data, the information, and the details of their conversations with their therapist is always kept protected. This slide shows how simple and supportive the Talkspace experience is for teens. Once a teen signs up and creates their account, they're matched with a licensed therapist who specializes in their needs based on their responses from the intake process. They can review their provider's profile and even watch an intro video to get comfortable with who their therapist is. From there, they enter their own private Talkspace room where they answer intake questions and can begin messaging their therapist right away. Teens have flexibility. They can message anytime when they're ready. They can also book live video sessions directly in the app. Typically, the therapist will start with an introductory message so the teen knows what to expect from therapy and how to get started. The goal is to make therapy approachable, private, and easy to access, meeting young people where they're at and giving them options to connect in a way that feels best for them. If there are, if for whatever reason the therapist is not a good match for the teen, they can easily change providers right in their main dashboard. We want the teens to be matched with somebody that they feel comfortable sharing things with, and that is a good fit for their mental health journey. The sign-up process for Talkspace Go is separate than the sign-up process for Talkspace Therapy. So if a teen is interested in the self-guided resources that are available for free, they would simply download the app or from the App Store or the Google Play Store, or they can go to go.talkspace.com to register. And we try to make this process very simple, and there is a very short registration process, and allows them to complete an assessment so that the Talkspace Go app can surface modules and workshops and information based on what it is that the teen is going through or what they might need support on the most. And now I'm going to pass it back over to Gabriella to talk a little bit about the Talkspace Toolkit.
Thank you so much, Lyra. I really appreciate that. We put together this toolkit to help empower you who reach the youth. We want to help your organization promote Talkspace and to ensure that you feel empowered to integrate these emotional wellness into everyday routines. So just top of mind is encouraging youth to visit our link directly. So again, that's talkspace.com/NCYouth, or assist them in the signing up process, in-person meetings, go through the intake session together, or during your check-ins. The sign-up process takes less than 5 minutes, really easy to do with the youth if they don't feel like comfortable doing it on their own. So here we have established a resource page where we kind of house all of these materials that include NC-specific youth resources like printable flyers, posters, postcards, videos, templates, all available for you to download. So if you would like to host as well a deeper presentation or training or a parent session or anything, you can also submit a request through the Talkspace informational request form that we'll be sending. And then, like I mentioned, even though parental consent isn't required, caregivers do play that powerful role in encouraging youth to engage. So we recommend all of you by expressing openness, reinforcing that therapy is safe, it's private, And then having these resources at your fingertips as well to help make you feel supported and help make you feel comfortable in going ahead and referring Talkspace to youth. In closing, I want to mention our partnership isn't just about accessibility, equity, and compassion. We're making sure that the youth that are impacted by the justice system can receive timely and confidential mental health support. So thank you for all of your essential work that you do every day for these young people and for being part of this mission to expand access and break that stigma around mental health care. I will go ahead and pass it to Kelly for Q&A.
Terrific. Gabriella and Lyra, thank you so much for walking us through the Talkspace resources. We are so excited. It's evident that this is easy to navigate. And thank you for those final tips on how we can get the word out and break down stigma and encourage youth to engage with Talkspace and to support their mental health. So we're going to move into the Q&A portion of our webinar today. I have a handful of questions that have already come through. So the first one, I'm actually going to invite Aaron and Lyra and Gabriella to join me, even on camera if you'd like. Because my first question is for Aaron, if you don't mind. Can you tell us a little bit about the North Carolina clinicians who work with the youth on Talkspace, as well as the training that they receive that equips them to work with our targeted population of justice-impacted youth?
Absolutely, Kelly. Hi, everyone. I'm Erin Mack. I'm a clinical risk manager here at Talkspace and also a provider on the platform. So thank you for having me here today. And just a little bit of a background on our North Carolina clinicians. So all of our clinicians are independently licensed and participate in our comprehensive onboarding process to ensure that they do understand the platform and expectations for their role as a provider on the platform. Training includes topics like clinical risk management and crisis management, trauma-informed care, specifically when working with teens, adolescent development, clinical approaches to working with teens, of course, culturally responsive care, and best practices for clinical documentation. So we really do aim to ensure that our providers are receiving training and education that expands their knowledge and understanding of the developmental needs, systemic factors, and the importance of a collaborative approach, specifically when working with our teen clients.
Terrific. Thank you so much, Erin. You mentioned training around crisis response. Can you share some information with us on what the SAFE process is that's been developed by Talkspace and what those steps look like for the clinicians who are serving our youth? Specifically thinking about what the escalation process is if a youth indicates any ideation about harm to self or to others.
Yeah, sure. So the SAFE process helps provide Talkspace clinicians with just some clear guidance and an understanding of how to manage and respond to instances where there may be an increased risk of a clinical crisis or emergency. So a key component of the process is to ensure that all clients are being given information about local and national resources available to them in the event of a crisis or an emergency, and that information is shared throughout the therapeutic relationship. So when there is an increased risk for the client's safety or someone else's safety, and it has been identified, providers will slow down and make sure that they are assisting that client, assessing them. And if it is determined that there is an emergency, the providers will focus on finding local help when, of course, needed. And this may be initiating contact with the client's emergency contact, or it could be reaching out to local emergency and crisis services as well. And providers are always expected to remain in contact with the client while they're in crisis until they can ensure that the client is safe and that local support has arrived. And of course, when possible, after the client has returned to baseline, clinicians will complete or update a clinical safety plan to ensure that it reflects any relevant updates that can better mitigate future risk and also support the client's treatment plan and their needs. We also do train and have an expectation that clinical documentation is completed that's in alignment with clinical best practice standards for continuity of care. So my team handles all of the adverse incident reports, which will result in a review, follow-up, and of course, a debrief with our team if needed to just make sure that we are supporting the provider, going over any concerns and issues, and then just ensuring overall compliance with Talkspace policy and procedure, which is in alignment with best practice standards.
Thank you so much for detailing all of that. We know that's often top of mind when we're thinking of a digital platform where we're not directly in real time in face to face engagement with our young people and their families. We appreciate the intentionality of your systems and follow up. Thank you. Looks like our next question that's come through. I think, Lyra, you may be the best to address this one. The question is, what does accessibility look like for youth who may face barriers to accessing Talkspace? For example, youth who speak other languages other than English and Spanish, or patients who are differently abled, right? Who may be deaf or hard of hearing, those who might not have strong internet access in rural areas, or maybe just may not be as literate with technology. So what are some ways that Talkspace has made accommodations for accessibility in some of those situations?
That is such a great question. I'd be happy to respond to that. So a lot there, but when we talk about accessibility, it really comes down to meeting youth where they are and removing as many barriers as possible. For language, Talkspace offers care in English and Spanish, and we also have a growing number of therapists fluent in other languages. Teens or youth can note their language preference during the sign-up process, and we will match them accordingly. For teens who are deaf or hard of hearing, Talkspace works great for them because they can communicate entirely through secure text-based messaging, no audio or video needed. And if to address the part of your question about internet or technology access, the platform is mobile friendly and works on phones, tablets, computers, and because it's asynchronous, they don't need to be online constantly. They can log in, send messages, and then check back later, days later, or even a week later, whenever they can access the service. It's also very simple to use. So even youth who might not be super tech savvy really can get started quickly. As I mentioned before, we make the process as simple as possible and really easy to follow along the steps in the app and on the platform. And finally, like for those who may feel any hesitation or stigma around mental health care, Talkspace offers private services. They can access the therapist from their own space at their own pace without anyone else needing to know. And that sense of confidentiality often helps teens feel safe enough to take that first step. And also on that note, one thing I want to mention is there is no obligation. And I think that provides a sense of relief for teens that they can, register, sign up, and just give it a try. And there's no obligation for them to continue using it for a long length of time. Thank you for asking that.
Yeah, it was a great question. Yeah, really love that answer, and just the opportunity that Talkspace provides our youth. It really empowers them, right, to really take action, right, for their own well-being, just as you were describing in their own spaces, in their own pace. I love that opportunity for empowerment. Okay, the next one. Aaron, I think I'm going to toss this one back to you, but others can weigh in as well. So in North Carolina, we have a really well-established system of care approach, which really, in so doing, we promote really collaborative and integrative coordination of care and services and cross-system support. So do Talkspace therapists have the ability to release information to other agencies or system partners who might also be supporting the youth with if there's appropriate consent?
Absolutely. So our clinicians can coordinate with other agencies or providers after obtaining a release of information to do so. So we do this in a manner that just recognizes the importance of coordination of care and that also maintains privacy and compliance with HIPAA and other state regs. So our health information management team oversees this process to support both clients and providers.
Excellent. Thank you so much. Um, okay, this one could really be for any of you again, but maybe Gabriella, what happens if a teen either needs or wants to meet with their therapist more than once a month virtually?
Yeah, I can help answer that question. So through the partnership, we do offer one live video session a month. These work in rolling credits. So if they take their first live video session, say today, October 28th, then it will be available for them to take in a month from there for their next live video session credit to be allotted in the platform with them and their therapist. If they wanted something outside of one live video session, we have the ability at a $65 partnership fee for them to go ahead and go through the process of a la carte, as I'd say, adding sessions to their program. But as of right now, through our partnership, we do give one live video session a month. If I missed anything, Tiana, please feel free to chime in. But yes, that would be how they would be able to. It's very clearly laid out on the app itself and the platform for them to go ahead and add additional ones. But right now, it's clear to them that their credits are one a month.
Great. Thank you for that. And that also creates a great opportunity for us at North Carolina just to emphasize that this cadence and these resources that we're talking about today are really tied to our investment with this targeted population, which again was a limited pilot. But Talkspace does have the capability to do more, right, than even what we've contracted to do in this pilot. So good to know for any of our partners who are on the call, if they'd like to explore Talkspace further or look at how that could be extended. Obviously, will share contact information and they're welcome to reach out to you all as well. Thank you so much for that. Okay, we've got a couple more questions that have been coming in through the chat. So let's see. Gabriella, I'm going to call back to you again on this one. Can you talk a little bit about how parents or caregivers can engage with Talkspace, since we noted that for ages 13 and up, parental consent is not required?
Yes, thank you for bringing that up. So as a reminder, through North Carolina state law, 13 up does not need parental consent to access therapy, but parents, caregivers, guardians can still play a really important role. This can be through their encouragement, their reassurance, their openness can make all of the difference in whether a teen actually engages and stays consistent with their therapy. They can go ahead and suggest to sign up for therapy. They can start the sign up process for their teen. We also have that North Carolina Youth Toolkit that I mentioned that was put in the chat as well, that has those printable flyers, posters, postcards, simple how-to guides that parents and guardians or even agencies can use when introducing this resource. So really, in supporting, they can just provide that encouragement that I know a lot of us feel could benefit the youth if they are feeling like they're shying away or don't feel comfortable. Just that little nudge from their parent or guardian can be all that they need to feel reassured and open to try therapy.
Excellent. Thank you so much. Okay, another one that's come in. Erin, what if a client who's been engaging on the Talkspace platform and engaging in virtual therapy sessions wants to transition to in-person therapy? How will Talkspace assist in making that type of referral?
So essentially, our Talkspace clinicians, they all do provide psychotherapy services on the platform via telehealth. But if a teen does decide that they want outpatient services, our provider would be encouraged, and it is the expectation that they would refer that teen to the appropriate resources as a North Carolina licensed provider, they should be familiar with resources, and then they would have access to other resources and can also reach out to the clinical team, including the clinical risk management team, if needed, if it's a higher level of care need or something like that. And our team also does manage the higher level of care process if in the event that a teen is presenting with higher acuity and needs support in that
Mhm.
manner as well.
Awesome. That's wonderful. Thank you. I have a related question because we're focused on youth, right, with this pilot in particular. And really, the platform is really designed to be very youth centric. How does Talkspace handle youth who we often use the term age out, but right, who really transition to young adulthood, who turn 18? Um, and so, how are we then looking at transitioning to age appropriate services, or for those who want to just transition out of services and want to conclude their engagement? Can you talk a little bit about those two processes for us?
Yeah, sure. So I think that one of the great things about our training is that we do encourage providers to have conversations early on in the therapeutic relationship about how long the teen would like to be in treatment, and also that age out process when they're eligible for services and when that ends, and being able to make appropriate referrals and have a discharge plan in place, which will look different, of course, for every teen. But we definitely want to support the teen in obtaining services if they need them after. And this is where some of that support also comes in if there's any family involvement or other services that are involved, if the teen needs to have that care coordination as well.
Terrific. Thank you. Um, we have a wonderful question from the chat from one of our colleagues who notes um, that they often engage with justice involved youth who also carry deep trauma. And we recognize that deep seated trauma can really result in lack of trust in many people, but also in professionals delivering clinical service. So, how does Talkspace approach trauma work, and how do your clinicians on the platform foster trust and engagement?
The great thing about Talkspace is that the providers have such varied backgrounds and expertise, and there's different approaches that they may take for trauma. Of course, they want to assess every client to make sure that they're able to meet their needs. But the great thing about having a messaging based opportunity for teens to engage is it gives them a little bit of a slower pace than having to jump in,
Mm.
let's say
Mhm.
live, so they can adjust to the idea of therapy and kind of like feel out the therapist. There's audio messaging that can occur in between live sessions, so it's not just text. The therapist and the client can also send video messages back and forth to one another. So all of our providers are encouraged to, of course, use the evidence-based practices that are specific to making sure that they're engaging and building rapport. But also, as mentioned earlier, too, if a provider or a client doesn't feel like there's a good fit or there is a concern of trust, they can always change to a different provider because we do have a vast amount of providers that are available.
I also thank you so much for that. I also want to flag in the demonstration, it was also shown that the youth can see a video of their therapist before initiating, right? So again, it kind of puts them in the driver's seat. So if the first match therapist, if they watch that video and they feel like it's not a good fit, what's the next step for requesting another consideration from the very beginning?
If the teen feels comfortable, they can have that conversation with the provider, but if not, it's a pretty easy switch. Gabriella and Lyra can probably talk a little bit more about this as well, but like the client just goes to a setting option and then they can transfer to a new provider. They'll see all of the available options. And then if that doesn't work and the team would like to request support from our client support team, they can do that as well and ask for what they're looking for specifically and get some support.
That's great. Thank you. Okay, these are great. We've got a really engaged group of folks on the webinar today. So earlier we had a question about how youth can access more frequent appointments. And we reference that opportunity to actually, to purchase, right? Kind of a fee for service structure. The question is, can those appointments be billed to Medicaid or other insurance carriers, or are those all private pay?
I'll be happy to take that question for the team. So, yes, that is
Thanks.
correct. So, for our specific youth program with North Carolina, we do cover that one therapy session a month that's fully funded through the state partnership. That is no cost to the eligible youth or their families, of course, and they don't need insurance and won't be billed for sessions. But if they do, if the youth wants to or needs additional sessions beyond what is currently included, like an additional live video session, that coverage can be covered through Medicaid and many insurance partners. We do partner with Medicaid and many major insurance plans. So if the youth has active insurance or their family has active insurance, they could explore continued care through that route and then go ahead and bill out to the insurance. If not, yes, we offer Talkspace at that private pay option, which would be $65 per live video session. So again, like the initial is no cost, no billing, but if they would like to do anything else, they do have that opportunity to go ahead and partner with their Medicaid or their major insurance plans through the platform. If they ever come into any, they can always go onto our help support page. We have a live chat widget. We have a support inbox, and we also have a ticket to go ahead and walk them through what that looks like, but it's pretty seamless through the platform itself.
That's great. Thank you. Another way of barriers being removed. So glad to hear that. Thank you. Erin, I've got one more question. I think I'm going to pass to you since you are also a clinician on the site. The question is there a limit to the number of youth that each Talkspace clinician assists?
It's actually a really good question. So we trust all of our providers to determine what their caseload should be. We have a very vast quality management team and clinical leadership team, though, that does keep an eye out if there are any concerns, of course, with the quality of care that is being delivered. So to answer the question, there is not necessarily a specific limit, but of course, we want to make sure that providers are able to provide the care that we expect. And should there be any concerns regarding that quality of care, that would be addressed from the quality management and risk management team.
Terrific. Thank you. I have one more sort of service delivery question. So Erin, feel free to answer, or Gabriella, either one. The question that has come through relates to medication management. And how does Talkspace support medication management for youth? And how do clinicians on the platform collaborate with prescribers or other professionals delivering intervention for the youth?
Yeah, of course. This is definitely an important question. And just to clarify too, that Talkspace at this time doesn't offer psychiatric services for anyone under the age of 18. However, this would follow that similar release of information process if there is a psychiatric provider that is involved with the teen, they would be able to sign a release of information and collaborate so that everyone is working together to ensure that there's coordination of care as needed.
Perfect. Thank you. Okay, we've got some more questions. These are great. So I'm going to pitch this one to either Gabriella or Lyra. Does Talkspace utilize AI?
Lyra, do you want me to answer there, or do you have it?
You can take it.
Okay, that is a great question. And I do want to thank everyone for being so engaged and asking all these great questions. This one we do get often, as we do see, the increase in usage of AI. Talkspace does not use AI at all. It's very limited and used in a thoughtful way when it is, and it's strictly to enhance the safety and support the clinicians, not at all to replace them. So the main example is our suicide risk detection algorithm. It's a machine learning tool that scans messages to identify language that may suggest self-harm or crisis risk. If anything concerning is detected, then therapist is immediately notified so that they can review it and decide if intervention is needed. It's important to note that this is not AI interacting with the client or making decisions by any means. It's purely that behind the scenes safety net that helps our licensed providers respond quickly and when the youth might be in distress. But outside of that, all the therapy communication, all the care decisions, they're entirely human-led and clinically managed. If I missed anything, Erin, I know you're a provider on the platform, so if there's anything you want to add to that, please feel free to, but just wanted to note that.
Great. Thank you. I think we have time probably for 2 more questions. So we'll wrap this up here. The next question, and I'm going to open it to anyone to respond. Are youth who have not been affected by the court system ineligible for this service? That might be a North Carolina answer. So for this current pilot, through our funding, we have clearly defined that targeted population, and that's really to evaluate how we can best reach this population of youth. As I noted, I think in the introduction, Talkspace has resources that can be beneficial for any youth, right? That supports mental wellness and accessible intervention. So I think that there are opportunities for future partnership, but in this current funding opportunity, we have defined a targeted population. Okay. And then I think we're going to wrap up with one final question for the panel. I do want to recognize that there are some additional questions coming through the chat still, and I encourage participants to continue to raise those questions. We will track them all and we will follow up with responses upon the conclusion of today's webinar. So let me raise one last question for the panel. And Gabriella, I'm going to, I think, direct this one to you. We teased this a little bit in the beginning at the introduction about how our community partners, agencies, caregivers, colleagues can help get youth connected to Talkspace. So what is the best way for them to do that? So as we wrap up today, what can they do next?
Thank you so much, Kelly. So our call to action today to leave with in getting youth connected, I would say, of course, the easiest and most direct way is through our dedicated landing page, talkspace.com/NCYouth. You all can take a look at it. There's engaging videos in it, testimonials from teens. It kind of gets the teen to understand what Talkspace is and walks them step by step through the process. And it only takes, again, a few minutes to go ahead and complete. But as far as how can you support that, we have that North Carolina Youth Toolkit that we put in the chat, and we'll send this a follow-up as well, that houses language around NC Youth and our partnership with the landing page highlighted, a QR code to direct the teen there. We have the flyers, postcards, posters, bookmarks, and videos, and we will continue to build out this marketing resource page. So let that be your source of truth when you want to refer, when you have want to print anything or want to add anything in any of your current communications, anything that you feel could serve you, please utilize that resource page that will have consistent marketing resources uploaded. And then we also have a request form. So if you want a presentation similar to this, go ahead and fill out that request form and we can present in front of youth, in front of any type of population you see fit. We do see the best type of utilization when we are talking to the youth directly. So if you ever think of any circumstances where we can get in front of the youth, whether it be in person or through something virtual like this, please feel free to keep us top of mind. We're definitely always open and ready to help engage in any of those type of discussions. So thank you all. I hope that helped answer your questions today. And like Kelly mentioned, we will table the rest that we haven't had an opportunity to answer and get those over to you.
Terrific. Gabriella, Lyra, Erin, thank you so much for spending time with us in North Carolina today. Thank you for answering so many of the questions that were raised up. Thank you for the partnership and for the wealth of resources that you guys have compiled for us in North Carolina so that we can do exactly that, outreach to our youth and their caregivers, and really get the word out about this amazing resource. With that, I'm going to pass to Dina, who will wrap us up for today. Thank you so much.
Thank you, Kelly. If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's event will be posted on our Community Engagement and Training webpage. For more information or resources, stay connected with DMH DDSUS by attending our monthly side-by-side webinars and joining our mailing list. The links are included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. This concludes our webinar for today. Thank you for attending.